Hello everybody and welcome to our presentation on type 2 diabetes mellitus. Please note that throughout our presentation you will see type 2 diabetes written in one of two ways. One, as you see it here, and the other as T2DM. Please note that these are used interchangeably throughout our presentation. Sit back and enjoy.
Diabetes mellitus is an endocrine disorder where the body is unable to effectively metabolize carbohydrates. This has to do with the amount of or effectiveness of insulin in the body. Insulin is a hormone whose role is to facilitate glucose entering the body's cells. As glucose is unable to enter the cells, it remains in the bloodstream, resulting in high levels of blood glucose. There are two types, type 1 and type 2. Today we'll be focusing on type 2. Type 2 diabetes usually develops slowly over time with gradual cellular resistance to insulin. There are many potential causes for the development of type 2 diabetes mellitus. A primary one is obesity, as fat cells are more resistant to insulin. However, the exact causes are multifactorial and not precisely known. Other risk factors and potential causes include a sedentary lifestyle, diet and gut biome, pancreatic disease, prolonged glucocorticoid use, and autoimmune responses. Roughly 9% of the total U.S. population has type 2 diabetes mellitus, with Hispanic, Native American, American Indian, and African American populations having a higher incidence and faster disease progression. The reasons for this are complex, including genetics, access to healthcare, socioeconomic status, and culture. Screening and education may be critical in treating these populations. What is insulin and how does it work? Insulin is a hormone produced by the pancreas. When we consume carbohydrates, they break down and the glucose from them enters our bloodstream. The pancreas produces insulin, and this insulin promotes the absorption of glucose into cells for storage or use. Too much or too little glucose in the bloodstream can have profound impacts on the body. Type 2 diabetes mellitus is characterized by hyperglycemia. Below you will see the ranges for what counts as hypoglycemia, hyperglycemia, pre-diabetic glucose levels, and diabetic glucose levels.
Warning. You are about to see small amounts of blood as we show you how to take your glucose levels at home using a glucometer. If the sight of blood bothers you, please feel free to fast forward to view the rest of our presentation. Have your equipment prepped and ready to go. You can either use an alcohol prep pad or wash your hands with soap and water. Check the glucometer test strips to make sure they are in the proper container and are not expired. You can use a 4x4 or small gauze pad to wipe away the first drop of blood to make sure the alcohol does not affect the reading. Make sure you have your lancing device and a Band-Aid if needed. Check your glucometer and make sure it is in working order and follow the manufacturer recommendations on the proper use and upkeep. Insert a test strip into the device, allowing it to turn on and become ready for a blood sample. Clean the site that you want to use. Do your best to make sure you do not directly prick the pad of the finger, as this can cause pain. After the area is cleaned and ready to go, use a lancing device to prick your finger and wipe away the first small amount of blood. Place a small amount of blood at the end of the test strip, and once enough is taken, the glucometer will begin to read the blood sample as you see here by the countdown. The glucometer will give you a reading of your capillary blood glucose levels. Be sure to dispose all equipment in proper receptacles.
When looking for signs and symptoms, remember the 3 Ps, or the 3 polys. They are polydipsia, or excessive thirst, polyphagia, excessive hunger, and polyuria, excessive urination. These are the telltale signs of diabetes mellitus. General symptoms of diabetes mellitus include the inability to focus or concentrate, feeling weak, and fatigue. Clients often complain of differences in their vision. Chronic fungal infections, particularly genital candida infections, may be present. This is because the increased blood glucose levels provide a great environment for these infections to thrive. For those clients who do not monitor their blood glucose levels regularly, controlled diabetes can lead to diabetic ketoacidosis, or DKA. In DKA, ketone formation occurs, dropping the client's blood pH, resulting in acidic blood. The client may present with dry mucous membranes, increased heart rate, hypotension, and fruity breath. Symptoms of DKA include hyperventilation, which is the body's defense to release CO2, thus increasing the blood pH. The specific breathing pattern is noted as Kussmaul's respirations. Other symptoms include the 3 Ps, abdominal cramps, nausea, vomiting, and weakness. The client may have varying levels of consciousness from alert to comatose. DKA can prove deadly if not treated. DKA is more common in type 1 diabetes than in type 2 diabetes. Poorly controlled type 2 diabetes mellitus can lead to hyperosmolar hyperglycemic syndrome.
Type 2 diabetes mellitus can have significant impacts on the body's organs and systems. Short-term impacts may include hyperosmolar hyperglycemic syndrome. This is characterized by blood glucose greater than 600 milligrams per deciliter. Signs and symptoms may include dehydration, hyperglycemia, hypotension, changes in mental status, lethargy, and coma. Long-term impacts can run across the entire body. The cardiovascular and circulatory system may experience accelerated atherosclerosis, coronary artery disease due to increased plaque buildup, peripheral vascular disease related to increased plaque, and narrowing of vessels in lower extremities leading to decreased circulation. Eyes can experience retinopathy due to narrowed retinal arteries. This can lead to blindness. The renal system can experience damage to the glomeruli and impaired renal circulation. This can lead to renal failure. The nervous system can be impacted in a number of ways, including peripheral neuropathy. This is related to decreased circulation to nerves and can result in a loss of sensation, especially in the feet, and a change in gait. The autonomic nervous system can sustain damage due to circulation impairment. This leads to postural hypotension, bladder and bowel dysfunction, anhidrosis, hypoglycemia unawareness, and the anhidrosis can lead to heat stroke due to an inability to sweat and decreased sensation. The immune system is also impacted as white blood cells cannot function properly in a hyperglycemic environment, leading to immunosuppression. This leads to delayed wound healing, increased infections, and amputations. The reproductive system can also be impacted. We can see an increase of yeast infections of genitalia due to increased glucose in the environment. The dermatological system can see delayed wound healing, more skin infections, skin breakdown, all due to immunosuppression or increased glucose. There are also psychological impacts. We can see anxiety, depression, eating disorders as well, especially insulin purging, where patients may intentionally not use their insulin appropriately so that they can eat without gaining weight, as the glucose cannot be used by the body without insulin. It is a dangerous eating disorder.
Since type 2 diabetes mellitus is related to lifestyle, risk factors would be obesity, a sedentary lifestyle, poor diet, or genetics. It is important to screen clients for diabetes mellitus who present as overweight or share one or more of the risk factors. One of the most important aspects would be to educate the client on the disease, treatment, and changes they can make. The first step would be implementing a healthy lifestyle. Changes in diet and exercise can have profound effects on a client's health and the progression of this disease. While specific diets are highly individualized, a good place to start would be the American Diabetic Association diet guidelines. Clients should aim for about 40 to 50% of their daily caloric intake to come from carbohydrates. 25 to 30% of calories should come from fats, and 25 to 30% from proteins. Aerobic exercises like running, walking, and swimming are helpful in aiding the body to use insulin. which reduces blood sugar. It is important to note and educate your client that they should check their blood glucose levels prior to working out, as hypoglycemia may occur. If lifestyle changes are not enough to control diabetes mellitus for your client, their provider may prescribe medications such as sulfonylureas or metformin to help regulate blood glucose levels. It is important to educate your client on avoiding alcohol while taking these medications. Clients should be aware that medications they may already be taking may react with diabetic medications or mask symptoms of diabetes mellitus. Some medications that can cause hypoglycemia include beta blockers, alcohol, and aspirin, while glucocorticoids and oral contraceptives or other estrogen therapies can cause hyperglycemia. Nurses should be sure to provide complete medication reconciliation for the client in order to provide the most thorough and accurate education to the client. Advise the client to regularly monitor their blood glucose levels. If they feel any symptoms of hypo or hyperglycemia, it is best to check the blood glucose level. A mnemonic device that can remind the patient to do if they are feeling symptoms would be, "I am hot and dry, I must be on a sugar high," reminding the client that they may be experiencing hyperglycemia. Or, "I am cold and clammy, give me some candy," reminding the client that they may be experiencing hypoglycemia.
Grab a pen and a piece of paper because the NCLEX questions are coming up next. Question 1. A client is being evaluated at the ER and is presenting with profuse sweating, headache, irritability, and disorientation. You note a medical alert bracelet stating they are a diabetic. What is the first action performed by the nurse? A. Begin an IV infusion of dextrose. B. Assess the client's blood glucose level. C. Document the client's level of consciousness. Or D. Administer 5 units of the client's insulin. The correct answer is B. Assess the client's blood glucose level. This answer is the most correct of the list provided because you always want to follow the nursing process, also known as ADPI. Assessments should always come first when providing care to a client, and in order to move on to the next step, we need to know the baseline vital signs of this client in order to realize that she is hypoglycemic, and this is done by obtaining a blood glucose level. Once it's established that she does have a low sugar, then we can follow the orders provided from the healthcare provider to treat her hypoglycemia. It's also important to note that in a hypoglycemic state, insulin will not be given, as this is given in a hyperglycemic state to lower the blood glucose levels. Question 2. Type 2 diabetes mellitus is resistant to what hormone? A. Growth hormone. B. Aldosterone. C. HHS hormone. Or D. Insulin. The correct answer is D. Insulin. The major pathophysiological process that causes type 2 diabetes is cellular insulin resistance. Due to the insensitivity of body cells to insulin, it causes the pancreas to attempt to compensate by increasing the secretion of insulin. This causes the pancreas to secrete greater than normal amounts required to produce a normal response. Due to this increase in secretion, the pancreas becomes exhausted and cannot continue to secrete the amounts of insulin needed to compensate for the glycemic levels. Thank you so much for joining us. We hope this presentation on type 2 diabetes has been helpful. Be safe and wash your hands.